You wake up, look in the mirror, and there they are again. The puffy bags under your eyes. Your blood tests are normal. Your kidneys are fine. Your heart checks out. Yet every morning, those swollen lower eyelids stare back at you. Most people immediately blame their kidneys. Some blame aging. Others spend hundreds of dollars on eye creams that never touch the real cause. But what if I told you that in a huge number of cases, the problem isn't your kidneys at all? What if the real issue is happening much closer to your eyes, inside the network of lymphatic vessels and fluid drainage pathways running through your face and neck? Here's a fact most people have never heard. Nearly 1/3 of all the lymph nodes in your body are located in the head and neck region. That means even a small disruption in lymphatic drainage can create noticeable fluid buildup around the eyes, especially underneath the lower eyelids, where the tissue is naturally thin and vulnerable. And if your neck muscles are chronically tight, your posture is poor, or fluid movement through these drainage pathways slows down, the first place you may notice it is right here, under your eyes. For the last 15 years, I've watched patients chase the wrong explanation for this problem. They worry about kidney disease despite normal lab results. They buy expensive cosmetic products. They try miracle treatments advertised online. Meanwhile, the actual cause remains untouched. Today, I'm going to explain what really causes under-eye puffiness, how to tell the difference between fluid retention and age-related eye bags, why your neck may be involved, and the simple steps that can improve drainage naturally. Because not every bag under the eye is a sign of disease, but not every bag is harmless either. And understanding the difference could save you years of frustration. Subscribe to Dr. Robert Ben, hit the like button, and let's uncover what's actually happening beneath your eyes. And here's where most people make a critical mistake. They assume every bag under the eye is caused by aging. It isn't. In fact, one of the biggest clues is whether those bags change throughout the day. If you wake up looking puffy, but the swelling gradually improves as you move around, work, and stay upright, you're probably dealing with fluid retention and lymphatic congestion rather than permanent structural aging. Let's talk about why. The skin around your eyes is among the thinnest anywhere on the human body. Even small changes in fluid balance become visible almost immediately. That's why poor sleep, excess salt, alcohol, dehydration, chronic sinus congestion, and impaired lymphatic drainage often show up first beneath the eyes. And yes, dehydration can actually make puffiness worse. When your body senses inadequate fluid intake, it becomes more aggressive about conserving water. The result can be fluid retention in tissues that are already vulnerable to swelling, including the delicate area around the eyes. Chronic nasal congestion and sinus problems create another obstacle. When drainage pathways around the nose and eyes remain inflamed or blocked, fluid struggles to move efficiently. The result is that familiar swollen appearance many people notice first thing in the morning. But there is another possibility. As we age, the proteins responsible for skin strength and elasticity, collagen and elastin, gradually decline. The connective tissues that normally keep the fat around the eyes securely positioned begin to weaken. When that happens, the fat can slowly push forward, creating a permanent bulge beneath the eyelid or across the upper cheek. Doctors often refer to these as Malar bags, or age-related fat protrusions. And this distinction matters, because fluid retention and structural aging are not the same problem. One responds to improved drainage and lifestyle changes. The other may require an entirely different conversation with a dermatologist or facial surgeon. Here's a simple observation you can make at home. If your under-eye bags are significantly worse in the morning, improve during the day, and become more noticeable after salty meals, alcohol, or poor sleep, fluid retention is likely contributing. If the fullness remains unchanged from morning to night, year after year, anatomy and aging are probably playing a larger role. Of course, this is not a diagnosis. Any swelling that is new, painful, rapidly worsening, or affecting only one side should always be evaluated by a qualified physician. Now let's talk about the system most people never hear about, the lymphatic system. Think of it as your body's drainage network. Unlike blood circulation, which is the heart acting as a powerful pump, lymphatic fluid moves much more slowly. It depends on muscle contractions, breathing movements, posture, and tissue mobility to keep flowing. And here's the fascinating part. Roughly 1/3 of all the lymph nodes in your entire body are located in the head and neck region. That's an extraordinary concentration packed into a relatively small anatomical space. The eyes, nose, sinuses, ears, salivary glands, thyroid gland, and surrounding facial tissues all depend on these pathways for proper drainage. Fluid from the eyelids, cheeks, and surrounding facial structures travels through lymphatic channels toward key drainage stations located around the ears, beneath the jaw, under the chin, and ultimately into the deeper lymph nodes running along the sides of the neck. When those pathways remain open and mobile, fluid leaves the face efficiently. When they become restricted, fluid begins backing up. And the first place many people notice that backup is directly beneath their eyes. This brings us to one of the most overlooked muscles in modern health, the sternocleidomastoid muscle. It's the long, rope-like muscle running from behind your ear down toward your collarbone. Every time you look down at your phone, lean toward a computer screen, or hold your head forward for hours, this muscle becomes tighter and shorter. The problem is that major lymphatic drainage pathways sit directly alongside it. Over time, chronic tension in this region can create a mechanical bottleneck. Imagine placing your thumb over a garden hose. The water doesn't stop completely, it simply flows less efficiently. The same principle can apply to lymphatic drainage. Fluid begins accumulating above the restriction. And above the neck sits your jawline, your cheeks, and the delicate tissue beneath your eyes. I've seen this pattern countless times over the years. A patient in her 50s spends most of the day at a computer. Her heart tests are normal, her kidneys are healthy, her thyroid function is normal, yet every morning she wakes up with puffy eyes and a heavier-looking face. On examination, the sides of her neck are tight, tender, and restricted. Her posture is forward. Her breathing is shallow. Over several weeks, as neck mobility improves, posture improves, and lymphatic drainage normalizes, the morning puffiness gradually fades. Not because of a miracle cream, not because of a detox, but because the fluid finally has a clear pathway to leave. So when does lymphatic drainage actually make sense? And when is it completely the wrong approach? This is where a lot of people get misled online. The internet loves simple answers, but medicine doesn't work that way. Research suggests that manual lymphatic drainage, a very gentle, rhythmic form of soft tissue therapy, can help reduce swelling after certain facial and neck procedures and may improve comfort in some people with mild fluid congestion. But there is a critical detail almost nobody mentions. True lymphatic work uses extremely light pressure, not deep massage, not aggressive rubbing, not painful kneading. In fact, trained lymphatic therapists often say the pressure should be so light that it feels almost insignificant. Why? Because lymphatic vessels sit very close to the surface of the skin. Press too hard, and you're no longer helping lymph flow. You're simply compressing deeper tissues. That's why any discussion about lymphatic drainage should always begin with one question. Have serious medical causes already been ruled out? Because red flags always come first, every single time. Eye specialists consistently warn that swelling around the eyes, accompanied by severe pain, significant redness, fever, feeling generally unwell, blurred vision, double vision, difficulty moving the eye, or sudden one-sided swelling requires immediate medical attention. Those symptoms can signal infections, severe allergic reactions, blood vessel disorders, or orbital cellulitis, conditions that can threaten vision and require urgent treatment. If any of those signs are present, stop looking for home remedies. Stop searching for massage techniques. See a doctor immediately. Now, let's assume you've already done the responsible thing. Your physician has evaluated you. Your kidneys, heart, thyroid, and other major systems have been checked. No dangerous condition has been found. You're simply dealing with persistent, soft, symmetrical puffiness that tends to be worse in the morning. That's where lifestyle factors begin moving higher on the list. Poor sleep, excess dietary salt, regular alcohol consumption, smoking, chronic allergies, persistent nasal congestion, sinus inflammation. These are some of the most common contributors to fluid retention around the eyes. And here's something many people overlook. Sometimes the problem isn't what you're doing, it's what you're exposed to every day. Dust mites in bedding, seasonal pollen, pet dander, cosmetics, eye products, even medications. A useful conversation with your doctor isn't simply, "Why are my eyes puffy?" A better question is, what factors in my daily routine might be encouraging fluid retention around my eyes? That question often leads to much more productive answers. Of course, we cannot ignore systemic causes. Thyroid disease, particularly autoimmune thyroid conditions, can alter the tissues around the eyes and create swelling or protrusion. Kidney disease can cause fluid retention. Liver disease can do the same. Advanced heart failure can as well. Certain autoimmune and rheumatic conditions may affect the blood vessels and soft tissues around the eyes. This is why persistent, unexplained swelling deserves a proper medical evaluation rather than assumptions. Now let's talk about the people who fall into what I call the relatively safe category. Mild swelling, no pain, no redness, no vision problems, normal medical testing, symptoms that fluctuate throughout the day. For these individuals, many lymphatic therapists pay particular attention to two anatomical regions: the area around the ears and the sides of the neck. Remember what we discussed earlier. A large portion of facial lymphatic drainage passes through lymph nodes located around the ears, beneath the jaw, and down the sides of the neck. If these pathways are functioning well, fluid moves efficiently out of the face. If they become restricted, fluid tends to accumulate upstream. And upstream happens to be exactly where most people notice puffiness: under the eyes, along the cheeks, and around the jawline. This is why professional lymphatic drainage protocols rarely begin at the face itself. They usually start lower. First the collarbone region, then the lower neck, then the sides of the neck. Only afterward does attention move toward the face. Think of it like clearing a drain. You create space downstream first, then fluid has somewhere to travel. One common therapist-guided technique involves placing the hands lightly around the tissue near the ears and performing slow, gentle skin stretching movements. Not rubbing, not kneading, not digging into the muscle. Simply creating tiny movements in the skin itself. The pressure should feel no stronger than gently stroking a sleeping cat. Anything deeper than that is no longer true lymphatic work. Many people report that after several minutes of this type of treatment, the tissues around the temples, upper cheeks, and lower eyelids feel lighter and less congested. That observation fits with the anatomy of facial drainage pathways. If this approach interests you, the safest option is not copying random internet demonstrations. It's asking a qualified therapist, physiotherapist, or healthcare professional trained in lymphatic techniques to show you exactly how it's done. When performed appropriately, gentle drainage techniques may help support normal fluid movement. When performed aggressively or used instead of proper medical evaluation, they can distract you from the real cause. And that's a mistake you never want to make. The second area that deserves attention is the sternocleidomastoid muscle. Most people have never heard of it, yet it may be one of the most important structures involved in facial fluid retention. You can easily find it yourself. Turn your head slightly to one side, and you'll see a thick rope-like muscle running from just behind your ear all the way down toward your collarbone. That's the sternocleidomastoid. And here's why it matters. Major veins and deep lymphatic pathways run directly alongside this muscle. When the tissue around it becomes chronically tight, as it often does from years of computer work, phone use, poor posture, and stress, it can create resistance to normal fluid movement through the neck. Think of it like a busy highway. The more congestion there is at a major intersection, the harder it becomes for traffic to move smoothly. The same principle applies to fluid drainage. Many therapists who specialize in lymphatic techniques focus heavily on restoring mobility around this region before they ever touch the face itself. Some self-care drainage programs teach very gentle techniques that involve lightly grasping the skin and tissue over the muscle and slowly guiding the movement downward while turning the head through a comfortable range of motion. Notice the word gentle. This should never be painful, never forceful, never aggressive. If you experience sharp pain, dizziness, tingling, difficulty breathing, or any unusual symptoms, stop immediately and seek professional guidance. People with neck injuries, vascular disease, cervical instability, or a history of stroke should never experiment with these techniques without medical clearance first. And that brings us to one of the biggest mistakes people make. They immediately start rubbing the bags under their eyes. It seems logical. The swelling is under the eyes, so that's where they focus all their attention. But lymphatic specialists teach the exact opposite approach. Why? Because fluid needs somewhere to go. If the drainage pathways lower down are already congested, pushing more fluid toward them can actually increase pressure and make the area feel heavier. It's like trying to pour water into a sink with a clogged drain. The water has nowhere to go. Professional lymphatic protocols typically begin at the collarbone region, then move into the lower neck, then the sides of the neck, and only afterward address the face. This follows the natural direction of lymphatic flow, from the face to the neck, from the neck into the larger lymphatic ducts, and ultimately back into the bloodstream. Simple anatomy, but completely opposite to what most people instinctively do. Now let's talk about something even more powerful than massage. Breathing. Most people underestimate how important breathing is for fluid movement. Every deep breath acts like a natural pump for the lymphatic system. When your diaphragm moves downward and your lower ribs expand, pressure changes inside the chest help pull lymphatic fluid upward and back towards circulation. Shallow chest breathing does very little. Deep diaphragmatic breathing creates movement throughout the entire system. That's why posture matters. That's why movement matters. And that's why sitting with your head pushed forward toward a screen for 10 or 12 hours every day works against you. Regular walking, gentle neck mobility exercises, better posture, deep breathing, adequate sleep, managing allergies, reducing excess salt and alcohol. None of these are exciting. None of them are glamorous. but together they often produce noticeable improvements in morning facial puffiness. And that's exactly why experienced clinicians focus on them first. Now here's something that becomes increasingly important as we age. The rules change after 40. The skin around your eyes naturally becomes thinner. Collagen production slows. The connective tissues that support the lower eyelids gradually weaken. At the same time, the lymphatic system becomes less efficient. Fluid that would have drained effortlessly at age 30 may linger much longer at age 60. This is why two people can eat the exact same salty dinner and get the same poor night's sleep. One wakes up looking completely normal, the other wakes up looking exhausted and swollen. Age changes the equation. How old are you? And have you noticed your face holding on to fluid more than it did 10 years ago? Because that answer matters. It helps determine whether the focus should be on searching aggressively for an underlying medical cause or simply managing the normal anatomical changes that come with aging. Let me give you a very common real-world example. Imagine a man in his early 40s. He comes to the clinic worried about large bags under his eyes. He sleeps 5 hours a night. He drinks heavily on weekends. Most of his meals come from takeout restaurants. He has chronic nasal congestion and he takes over-the-counter pain medication almost daily. His heart is healthy. His kidneys are functioning normally. His blood tests are reassuring. In a case like this, the first conversation isn't about lymphatic massage. It's about sleep, alcohol, salt intake, hydration, nasal health. Because those factors influence fluid retention throughout the entire body. Once those major drivers improve, then it makes sense to fine-tune posture, breathing mechanics, neck mobility, and lymphatic support. That's where the extra gains often come from. So what should you actually do if under-eye puffiness is becoming a daily frustration? First, make sure major medical causes have been properly evaluated. Kidney function, heart health, liver function, thyroid status, autoimmune conditions, medication side effects. Don't guess, know. Second, take an honest look at the lifestyle factors that influence fluid retention every day. Sleep quality, salt intake, alcohol, smoking, hydration, allergies, sinus congestion. These often explain far more than people realize. Third, if serious conditions have been ruled out and fluid retention appears to be the primary issue, ask your doctor whether working with a physical therapist or qualified clinician experienced in head and neck lymphatic techniques may be appropriate. And finally, if a specialist has already determined that what you're seeing is mostly age-related, fat pads, loose skin, or structural changes around the eye, stop chasing miracle drainage tricks online. At that point, the conversation shifts toward realistic cosmetic options, skin quality, and healthy aging rather than fluid management. Because the solution only works when it matches the actual cause, and that's the principle most people miss.